There's been a
All right, let's come to order at 7:00. Any members of the public with us this morning on the video feed or here in the room? Hearing none and seeing none. Can I get a motion to approve last month's meeting? All in favor?
Aye.
Don, you're up.
All right. Well, good morning, all. As we'll see in a minute, it is here, and it is our new mobile unit. And so, after this report, we'll run out and take a tour and get to see our new mobile unit. We had our groundbreaking yesterday. We got on the NPRs or YPR radio last evening, and then again today we were able to get a spot in the Billings Gazette, even though we didn't get any video coverage from local TV. We got the word out. Bill Brown from KGHL, Mighty 790, will continue to support us with radio hits, and even got the numbers of our gals who will be driving up to Broadview and wants to do a live hit with them as they're going up to Broadview and let the community know what they can expect in terms of services. So we'll have plenty of continued outreach with our Wellness on Wheels vehicle. I put in the report that hospice golf volunteers were still needed. However, we got the report last night at the foundation board meeting that we're chock full of volunteers. And so that's a good thing. People answered the call and will be covered for the 2 days. So thank you, Coach, and thank you, Jim, for volunteering as lunch hosts for your respective days. And
Be aware we're not cooked.
Yeah, but we eat.
Oh, yeah.
Certainly can eat. Just continued congrats to our development coordinator, Kelly Murphy. I keep hearing that this is the first year and was able to confirm that we've ever sold every single whole sponsorship and every single major sponsorship for the golf tournament. So kudos to Kella for pulling together a great tournament. In other news, we selected Ms. Kevy Berger as the executive director of the foundation. Foundation board members had an opportunity to meet her last night, talk to her about her vision for the foundation. And Kevy comes back to Billings by way of Missoula, where she held several nonprofit roles and was engaged in different opportunities out there. And she started with us Monday. So she's now almost 4 days into the role.
She speaks really well, comes across good. I think she'll do a great job.
Me too. Super connected to the mission, and one of these days we'll get her here to introduce to the full board. So our new mission, vision, values posters are making their way up across the organization, and I don't see one in the room yet, but it'll be here. We had the chance to reevaluate our mission, vision, values and strategic pillars as part of the strategic planning process. And we worked with the Board of Health, the clinic board to have these conversations. And so our new vision has been updated to create a healthier, safer community where everyone can live their best life. Our core values of service and core strategic pillars of health still remain the same, but we were able to now create a mission, vision, values with our core strategic pillars and advertise those and share those across the organization so that we're all rowing in the same direction. Continue to have some meetings on strategic planning and implementation with each department across the organization and gain some good feedback. Last Friday, Congressman Downing stopped by, spent an hour with us talking about all things impacting RiverStone health, And we sent him to Washington to vote on the big, beautiful bill with the mindset that any changes to the per capita amount of funding or any changes to the FMAP would have very dramatic and detrimental effects to the Medicaid population in the state of Montana. And he held up to his promise and voted for a package that didn't include any of those provisions. And so we will be able to work with congressmen and others now that the bill has passed the House. We're waiting to engage our Senate colleagues and hopefully get the same thing out of the Senate so that we can keep Montana Medicaid, and do some innovative things with community engagement requirements as they're already written in the Health Act. More to come there, but we had a great visit, opportunity to talk about what we do, garner his support for that work, and even potentially have the opportunity to request some additional funding for the Yellowstone Valley Childhood Advocacy Center in the coming months, and some other key projects that we have cooking. May is Mental Health Awareness Month, and so we continue to spread the word that it's okay not to be okay, and as long as you have the strength and courage to ask for help. So we're here to provide that help, and one of the things that we pride ourselves on at RiverStone Health is creating a workplace culture that makes it okay to ask for help, whether it's through our employee assistance program, EAP, our starter groups, purple groups for resiliency and well-being, asking the questions, the hard questions through well-being workbench surveys and other initiatives to figure out where our staff are and how we can better support them and help with navigating life's challenges. We want to do that here at RiverStone, so we'll continue to work on that. Today, late as this morning, if you're still around, our Women's Health Fair kicks off. And so stop on by main campus. We'll have priority appointments for women, as well as the Intermountain Health Mammal Bus, which will be outside. We'll have some food trucks as well, visiting campus. So come on out for some food, coffee, and learn about women's health. Construction continues on the swimming pool last week, but future bus barn. Now that the water dried out, the barn for the mobile unit is continuing on schedule. So we hope to have that built soon. For now, our mobile unit is being stored at, correct me if I'm wrong, interstate storage?
Yes.
All right. Interstate storage, and we'll move that on site as soon as the barn is completed. As of this report, we were waiting on an offer acceptance for our behavioral health systems improvement specialist. That offer was not accepted, and so we're back to the drawing board, working on recruiting our behavioral health systems improvement specialist, who will help us with the initiative formerly known as Substance Abuse Connect, my best prince. On Friday, May 9th, we held our annual plant sale, and we got about $5,000 here, raising money for our healthcare for the homeless programs and community breakfast in South Park, which will be when, Nicole?
August 6th.
August 6th. So join us August 6th in South Park. You look for the Wonder Wagon, our Wellness on Wheels vehicle. It will be at the gazebo in South Park for our annual healthcare for the homeless breakfast. If you haven't heard me on Spotify yet, you can now have the pleasure. Listen to our KGHL initial interview with Taylor Brown, talking about the importance of rural health access, mental health, decreasing behavioral health stigma, and bringing our new mobile unit out to rural communities and schools across the region. We had the opportunity to work directly with Billings Parks and Rec and put up some signs at city parks across our area, thanking folks for keeping our playgrounds tobacco-free. And so goal of this initiative is to keep our parks tobacco-free as possible and educate folks on the dangers of tobacco use and secondhand smoke around young lungs as well as old lungs from caregivers. We are working on planning exercise for a point of dispensing for medical countermeasures and mass vaccinations in the event that we need to crack that plan open again. I'm going to be reaching out to our county commissioners to make a request for the metro space. When our PEP, Public Health Emergency Preparedness folks did that, they were requesting about $3,000 to use the space for the day. I think we can figure that one out with the county. RiverStone Health now has several individuals on staff who can serve our team members and even community members who are exposed to potentially traumatic events. So we have a critical incident stress briefing team or critical incident stress management, CISM or CISDF. It's a facilitator-led group process so that if individuals are experiencing a traumatic event, whether it's a teenager in a car accident, on Airport Road, or right down here, we had last year, fire event, flooding, something on campus that happens to or with one of our patients or clients. We have a group now that can help our staff overcome secondhand stress and debrief the crisis. Our preventive health program coordinator, Jenna, and sanitarian Jordan went out to the DUI task force of law enforcement and other community leaders and continued the conversation about the health risks and regulatory challenges of kratom, kava, other substances, designer drugs. Talked about how can we get synthetic kratom off the street and out of the corner store. And we had a really good conversation with questions from law enforcement and other partners. While the legislative efforts to regulate kratom failed this session, we do have some potential momentum going into the interim to help continue this conversation. And along with our policy committee, we're going to be working with our governing authority, the elected leaders, city council, county commissioners to figure out what kratom regulation looks like locally and how can we step up and protect citizens in Yellowstone County. So more to come on that. Excuse me. As the flu season is effectively over, allergy season, as you can tell, is picked up. And so my allergies are raging. I'm going to the East Coast next week for a family wedding. And so I'm sure I will come back stuffy and congested with my normal East Coast allergens. But as of 5/15, Montana has seen a total of just over 1,050 hospitalizations out of over 15,500 cases of flu. And we had, unfortunately, 65 total deaths this year in flu season. In terms of measles, you may have seen, we now have a newly confirmed community spread acquired case of measles up in the Flatheads. That individual traveled to southern Alberta, and where there is a raging measles outbreak at the moment. And so we expect out of North Dakota, out of Alberta, to see additional measles cases coming to Montana. Like I said, I'm going on vacation next week, so sorry guys, it may happen while I'm out. We expect more cases and more community spread, particularly as a result of the Williston area outbreak. The individuals traveled to and went to the Williston Walmart, which is just a central hub for northeast and north central Montana to go and get supplies and shop, as well as a couple schools in Williston. While the CDC is going through their changes federally, they've been sporadically updating and monitoring measles and other data and information. We've turned to Johns Hopkins, to Corey, to their Center for Outbreak Response, and they have the latest information and monitoring in real time. And so we're going to continue to get the latest and greatest data so that we can keep our folks informed. We are drafting up our local press releases, dusting everything off in terms of our local HONs, so that when we do have a local case of the measles, we can take action appropriately. As of May 8th, there are over now 1,000 confirmed measles cases nationally across 31 states, and at least 5 states have reported 10 or more cases, which is super unusual. So there's more states and more outbreaks than are typical of measles on an annual basis. You can see the ages. Majority of the cases are under 19, and it's affecting our youth. The majority of the cases are all unvaccinated, not over 96%. And you can see it's more severely impacting the percentage of the ages that are hospitalized are under 5 years, as well as those under 19 years. So we continue to see our youth being impacted negatively, which is why it's important to get a highly effective, highly safe, highly proven vaccine developed by a Montanan called MMR to protect yourself from the measles. So I did add some information about Alberta there. As of 15th, there have been over 400 cases, and over half of those are in southern Alberta and towns bordering north central Montana. And I did see in the news this morning that the Chief Mountain border crossing is now open for the season. And so it'll make folks travel that much easier to get down here through Great Falls and then down into our region. So we continue to monitor and continue to watch, but it is not a matter of if at this point, it is a matter of when Yellowstone County will see our first case of measles. Questions?
Hey, John, I got a quick question for you. Why
Give
such
me 1
a
second. Hey, Steve, give me
Okay.
1 second.
Let's speak.
Oh, we're going. Michael's deferring. Okay.
okay? Thank you, Michael.
Well,
Why the propensity, or not propensity, but why the amount of cases in southern Alberta? Anything would be driving that? I mean,
highly unvaccinated population. A very it's a Amish community and a high propensity of colonies.
okay. You just said, okay. It's just because of the Canadian health system is a very robust system from what I understand. And so that is surprising. But when you said Amish and colonies, then I think I understand why. So,
Yeah, very low vaccination rate.
okay. Thank you, Michael.
I think there's a misprint there. That very last sentence should read, outbreak prevention relies on at least 100% vaccination rate.
So, yes, and the data shows that 95 is good, 100 is best.
Fair enough.
Yes.
John, just on news last night, they talked about a recent, in the last few days, seizure of a huge amount of fentanyl and carfentanil, which is apparently very concerning. I don't know if anybody else saw that.
Yeah. What is that?
Carfentanil,
It is synthetic fentanyl.
it's way stronger and more dangerous.
Yeah, so we have a really good process for getting information about, drug travels across the state, as we've outlined in the past, and a really good connection with our EPI team and others to be able to put out awareness campaigns. We immediately go to social media and say there's a bad batch of drugs. Here are the dangers. This is what's happening. we're able to get in touch with those patients and clients who we know are using and do targeted outreach in that fashion too, and warn them about the dangers and try to get them into treatment. We do have a good, fairly decent network of connections to make sure that we get on top of those situations when they happen.
They described it as it's used to tranquilize the element.
Well,
Other questions for John?
Mm-mm.
All right. You want to run see it, or you want to go through Megan's report?
I think we need to get it. We need to get it out on the road. Okay, we gotta go.
Yeah, let's go.
All right.
We'll pause. Go see the new clinic.
See you in a minute, Dave.
Mobile clinic. Okay, let's reconvene.
They'll be the confirm.
Michael, do you want to say something?
It just occurred to me while during the bus. It's fantastic. I was talking with an individual just this week, wealthy businessman from town. And of course, the conversation mentioned RiverStone Health, and he looked at me a little bit irritated almost. And he said, I don't know why they're even there doing nothing. And I'm paraphrasing, doing nothing but competing with the two hospitals up the street.
Invite him for a visit.
Have a conversation. Yeah.
I don't know that I got him straightened out, but he said, I'm not timid about speaking sometimes. I try to straighten the guy out. But I don't believe that opinion is just that one uninformed individual. Here's why we're not just competing, we're out competing. I don't think either of local hospitals can do what we're doing.
No.
To go provide care across the community. That's why we're here, and we're doing a better job. And we have to just continue to advertise it.
I think we're doing a different job, right? I mean, the hospital systems really, we couldn't survive here. We community health centers can survive without large hospital systems, but it makes our ability to care for our patients comprehensively so much better with our partnership with with the two hospital systems that are here. But I think that we provide care in a different niche and in a different way than even the primary care programs at the hospitals are sort of viewing healthcare. So I don't think it's a competition. I think that it's really a symbiotic relationship. Now we still, we're competing for some patients, obviously. I mean, we need to, what is it called in the Lego compa? There's a word. Cooperation. Yeah. Lego Robotics has a whole concept of cooperation where you're cooperating but competing with the other groups, and that's what we do.
I think I got that point across to this individual. Whether he accepts it or not is something else. I think I made that point. And
but I think if you guys are ever entering into those conversations, I know I am always happy to tour people around.
Bring them here
and invite them for a tour. We can show them what we do. And, I think people are really surprised when they come in and learn the breadth of what we do, and they look at our clinic and how nice it is. And it kind of blows away a lot of preconceptions they have about what RiverStone is and what we do and who we are providing services for. So feel free to invite them in. I can help coordinate that, Megan. We'd love to walk people around.
We love to show it off.
Yep.
Okay, Megan, keep talking. What's your report this morning?
Well, first, I want to apologize that it's the second month in a row that I do not have a written report. Last month, I was actually, John mentioned the Child Advocacy Center. One of the big things that we have been focused on this year is trying to fill that gap for the medical exams for the Child Advocacy Center, which is the center that evaluates and takes care of children who have experienced child abuse. And we've had a big gap in the community that we really tried to get one of the hospitals and other people to step up and help us fill that gap. And we were unable to do that. And so I have stepped into that gap temporarily while I really work to rebuild a system of how we're going to provide this really needed service for the eastern part of the state. And so last month I was actually out at the Rady Children's Hospital at their they have a child abuse center there that has been around since the 70s. And I was there doing a medical preceptorship there. So that was last month's excuse. This month's excuse is that, so the National Association of Community Health Centers, and I was talking with Coach about this yesterday, and he said, you know, it'd be a great thing to talk about at the meeting. So the National Association of Community Health Centers, which is our association of the community health centers across the country, there are over 1,000 community health centers who sort of do the work that we do. They have a number of committees that sort of address different issues. And John and I sit on a number of those committees, and the committee meetings were this past week. And I'm currently the chair of the clinical practice committee. And so the clinical practice committee is charged with, one of the larger committees that NAC has. And it's the committee of clinicians. And the charge for the committee is really to engage clinicians across the country in the pillars of NAC and what NAC, you know, sort of stands for. Really look at emerging models of healthcare and innovative systems that are developing across the country, and sort of share and spread those best practices, and to be the clinician's voice to NAC as they advocate for health centers. And so you can imagine we meet quarterly, twice in person and then twice virtually. So this was our virtual meeting. And the last several meetings have been really dominated with, quite honestly, a dark cloud about the impact of the new administration coming in, and how clinics across the country were going to continue to provide the care that we provide and the services that we provide, with some of the executive orders that were coming out, and with some of the financial impacts, and how do we continue to really treat our marginalized, you know, some of our patients that are most marginalized, who are being impacted directly by some of the things that have happened. But we wanted to reframe the conversation, because we know we need to be able to partner with the current administration. We have had bipartisan support since the beginning of community health centers. And so we really need to figure out, how do we get on the same page with aligned priorities. And the whole concept of Make America Healthy Again, and John has talked about this, a lot of that, you know, how do we combat chronic disease? How do we look at how environments impact children's health? How do we look at how to address mental health? You know, how do we prevent some of these emerging, you know, diseases? This is what community health centers have lived in this lane, you know, really since the beginning, right? And so our whole conversation on this week was really focused on that concept of food as health, right? So, you know, one of the things that has been starting to talk about is how, you know, how healthy food and things that are more natural, how that can impact health. And so our conversation was, as health centers, what are we doing to address this issue of food as health with our communities and with our patients? And we were talking about that from a couple of different ways. What are the innovations that health centers are doing across the country and have been doing? So many of us have been doing this work, you know, for a while, even before, you know, these recommendations came out. Who are the partners in communities that health centers can partner with? Because we recognize that health centers can't do this work in a bubble, right? You need to have community partners to really impact, that ability to have food be something that we consider. It's easy for me to write a prescription for healthy food, but if a patient can't go out and get that healthy food, then that's not very, or they don't know how to use that healthy food, that's not very helpful, right? And so so what are we doing? Who are the partners that people are engaging? And then what are the metrics that we're going to look at to follow to see if we are impacting the health of the community? And so, I think we are, I was facilitating our breakout group, so I didn't share a lot of the awesome stuff that we're doing. But when you think, one of the things that makes us so powerful here is this relationship with public health, the fact that our community health center is already naturally part of the public health system. So they're natural. We don't have to go out to partner with public health. We actually are, public health. And so that, I think, puts us already at a spot where we have a broader reach in how we think about this as a community. We have, an example of that is our gardeners market, right? So, so it was identified that there was not an opportunity for many of our South Side residents to have access to, to healthy food. And the farmers market wasn't always accessible to everyone in our community. And so the whole creation of the gardeners market and have that being in South Park, that is, a great example of how we're doing this. We also have care managers, health centers in general have been looking at food, access to food and disparities with access to food. And so we've been doing that for a long time. And we have our care managers that help connect people, to the food bank and to other, resources that are in town to help with food. There were other health centers that have, there was one that had a refrigerator. They had a community refrigerator that they had at their health center where different agencies helped to sponsor it, but it was essentially a large refrigerator that was continually stocked that people could just come and take, food out of it. Largely pantries are non-perishable foods. Well, non-perishable foods, quite honestly, are kind of those processed foods, right? Like it's a lot of mac and cheese. It's a lot of canned soup, hamburger helper, like all of those things are highly processed. And that's oftentimes what, food banks, offer. And so being able to offer sort of a variety of more healthy foods. But what I thought was interesting was some of the health centers who have really partnered with private companies in their, and private industries in their communities to really expand some of them. And that is sort of what I wanted to get all of you thinking about what are ways that we can partner with, other partners that we wouldn't classically think of, but to be able to kind of really dive into this. How do we make food medicine in our community? And so I thought I would just kind of pick your brains and see if anyone has it. And this obviously, more to think about. I'm planting a seed. I think we should have more conversations about this going forward, but wanted to kind of just plant that seed for us to start thinking about that.
There was this sort of fits in with the story I also saw in the news last night about the local beef growers providing local beef to schools.
Right.
So that they can have at least grown nearby that it helps the ranchers as well as helps the kids in the school. Just as an example.
Mm-hmm.
Partnership.
The Yellowstone Valley Food Hub is they've been active maybe 2 or 3 years. It's a place where local growers, ranchers bring their goods and you buy them from them. I can't imagine they don't have, they'd be an interesting place to discuss partnering because it's very much, it's like in real food.
Right,
Yeah.
right.
Yeah, and all local.
maybe the, like Montana State University system, they might have like, food programs where they're trying to do research and provide, gardening seeds, different things. So they're always doing research and doing outreach and of course, they've been pulled back a little bit with lack of funding,
Right.
grants, so some other programs are on hold, but I mean, there's some great opportunity through Montana State University. I can't tell you where, but I've just seen them talk about it at some of the events.
I remember seeing something on the news or reading it in the paper about people working with the retailers, the grocery stores, to get the produce that was good, but didn't present
Sell.
well. Yeah.
Yeah.
A bruised apple or
Yeah.
whatever,
Mhm.
and getting that somehow to the food banks or
Yeah.
getting that out to the people.
Yeah, that was one of the things that I thought that I was like, oh, we should look into that some more, because there were a number of places, and that was one of the things that we asked to NAC, was if NAC could work at the federal level of creating those partnerships with Albertsons or some of these larger chain grocers, and start to forge those relationships so that every community isn't having to do that, locally in their community, that would be helpful. But that was one of the things that I started to, sort of think about, is how do you do that? How do you do that with, and even like restaurant waste? You think
Right.
about the amount of food, and how do you turn that so that the private, the grocery stores and the restaurateurs, are not seeing that as a loss of business, right? Like, why should we be giving food away when we could sell food, right? And so, how do you navigate those conversations so that we're able to not waste, some of that, and be able to, provide it to people who are unable to.
I think we think a lot about fresh fruits and vegetables, but frozen, right? There's research that say it's just as good, so maybe look into that. Freezer with frozen food.
Yeah, I thought that was a cool idea.
So Megan,
Yeah.
one of the things I know we do at Stella's, I mean, we have certain days or length of time that we will keep product on the shelf. And then at that particular time, I think it's just a matter of reaching out to types of restaurants to do it. So we have pickups 3 times a week. Family Services, I believe it's Montana Restoration, so our product that is still good product, but it's it's beyond the date that we would consider a fresh product. And so I believe that there are a variety of restaurants that are in that same boat, that when they walk through their boxes or they go through that, there's just never been, first of all, they really don't think about it that much. They would probably tell you they don't have that much waste. I would tell you the bakery is, I have far more than I do in the restaurant, but still I think it's just a matter of getting out to the restaurants and saying, hey, but having it simplified so that they can, if I had to take it and deliver it to someplace, it would be a royal pain for me. I mean, Family Services, MRM comes by and picks up these items for us. So
Seems like a great job for a team of volunteers to set up a network and then have a team of volunteers who are doing that on a regular basis. Some of it is just setting up that infrastructure, right?
It must be.
well, you've got the Meals on, what is it? Meals on Wheels?
Meals on Wheels, yeah.
Yeah. And so, and once again, thinking, so they're going out, but as they come back, do they make a stop, or do they have 1 or 2 stops that they go by on a regular basis that they go, okay, hey, I bring that back. So that would be, to me, at least a point of discussion with them potentially.
I think that obviously there is a huge network out there now, because like the Rescue Mission and Family Service, they go through tons of food.
Right.
So I think they are getting things from Albertsons and Steve says from restaurants and whatnot too. That is a matter of tapping into that.
Yeah. Yeah, I think thinking about the mobile unit too, right? Is there like a small, it's hard to figure out how to, I mean, you guys have seen the mobile unit, it's pretty small. We're not able to have a huge food pantry there, but is there some way that we can have some essentials, you know, maybe when we go out to some of the communities? Because I think that's true, MRM and family health, but family services, but they still connect with a fairly small group. We know that there are a number of other people who do not touch those agencies that have food insecurities. Like I see it every day in my, you know, in my kids that are worried about summer because that means that there are several meals that they're not going to get, you know, during the day.
Maybe some
Hey,
volunteers. High school.
Megan, I'm sorry to interrupt it.
Yeah,
Sort of.
no,
Yeah, I just got. So I'll tell you what. When I get back, I'll work with you. And so I'm thinking of the mobile unit. And you're right. They don't have a lot of space. But let's say the mobile unit's going out to Broadview tomorrow, and so, and I know they don't have a set schedule at least yet. Is to sit there and say, okay, hey, you know, we call you or you call us, and we sit there and say, okay, you know, I've got 15 loaves of bread, you know, some cinnamon rolls and some other things that take up a little bit of space, but could then be used to be given out at when the mobile unit is in that community. I'd have no problems doing that and working with you and trying to figure out timing and how we do it. Sometimes we may have a lot, sometimes we may not have much. But you know, it's worth a shot.
yeah, great.
Michael would want some of those extra cinnamon
Yeah.
rolls too. Any other comments for Megan?
All right, new baby residents are starting in 2 weeks. We're excited to have them come. And Bob's team is helping us to move our EMR to the cloud this weekend and to upgrade. So there's been a lot of work that has been done to get us prepared to do that. So those are my other two updates. Thank you. This was actually I think this was a really interesting, you know, conversation. And so thank you for the idea of chatting about this here, Coach.
This is the best report you've ever made.
Well, I know, yeah, just hopefully more often and, you know.
She
do it
wasn't
all.
talking.
Is the baby class full?
Baby class is full. Yeah, I shouldn't call them baby residents, but they're so bright-eyed and bushy-tailed when they come in and they're excited and, you know, and then residency takes a little bit of life out of you. We send them away feeling good, but they're always fun to work with when they first come in.
All right, Brent, you're up.
Okay. We always look at legislation, and this is our first meeting after the close of the state legislature. And John, of course, point person on that. In the past, John's report has been somewhat a little bit gloomy, so I asked him if he could today be a little bit more upbeat.
More positive. Yeah, yeah. Well, you know, we 170 different bills that we were tracking, we're working through and made it through committee. A few bad bills, quote unquote, passed, but none of the majorly bad bills that could have had a detrimental impact on us or childcare or, you know, our public health ability and whatnot got through. So there was one new administrative rule that has passed that is going to become an potential issue. We don't see it, and council can chime in from a legal perspective as a true hindrance, but it is going to create a lot of confusion across the state. And there's a new an administrative rule that simply removed language from childcare regulations that was in the previous arm that stated, it was very explicit about how children could be excluded from childcare settings if they were unvaccinated. What happened over the session and pre this last session was there was a committee. They objected to that removal, but it was all pending action in the legislature this last legislative session. There was no action taken during the legislative session to change 702, the vaccine discrimination bill, or to change the arm in any other way. And so the new administrative rule went into effect, removed some of the language around exclusions of unvaccinated children. And DPHHS and other entities are saying that they let that happen to further align with the intent of House Bill 702 and anti-vaccine discrimination. However, all they did in the arm was remove the language about exclusion. They didn't say thou shalt not. They didn't say I can't. They didn't do anything explicitly. And to that extent, House Bill 702 explicitly calls out and states that child care facilities and schools are exempt from the anti-discrimination provisions within House Bill 702, which still maintains my public health authority and our board authority to exclude unvaccinated children from schools and daycares to prevent further spread and illness and death in a highly susceptible, high-risk population when measles comes to town. So all of that to say, nothing has changed from our perspective. Yes, there is a lot of conversation happening around the state. Other jurisdictions, smaller counties, even DPHHS, trying to say, hey, wait a minute, no, things have changed, and public health isn't going to be able to exclude highly at-risk children from getting sick or possibly dying as a result of these changes. But that is not our interpretation. Is that correctly stated, Jana?
Yeah. You know, nothing has changed legally. The legislature hasn't changed anything. The courts haven't changed anything. It's all been very consistent. The only thing to be aware of that could affect all of you is if DPHHS begins telling particularly child care centers that something has changed and they do so incorrectly, you may be getting an earful from folks who either want it changed or just don't agree. So if you do, I recommend talking to John about it because, you know, we have a pretty thorough explanation as to why we can continue to exclude unvaccinated kids in those circumstances. But it's unfortunate DPHHS creates a little bit of an upheaval on this, but you know, we're very solid in our legal position. So that's nice.
And we worked with the department last week and weeks prior to have this conversation and said, listen, you're about to send guidance to child care facilities that directly contradicts with what we are going to have to do when we have a measles outbreak. And so as of now, I haven't seen the guidance from DPHHS go to child care facilities, or child care facilities haven't sent it to us. Eric, have you seen anything?
No.
No. So I think we have effectively pushed back enough to DPHHS to say, listen, you cannot go send guidance out to child care facilities that contradicts with what we're going to have to do and with what our current authorities say we can do. It would just continue to undermine that public trust in this process. So we're continuing to monitor that. I bring it to you today for your awareness, then so you can support or not support me as your health officer. When I come to you in the future and say, I had to do this and this is why, if I get a 6-month sabbatical at our nearest county facility, so be it. we will challenge it because it's the right thing to do for our kids and to keep our youth safe. We're not going to force anybody to get vaccinated. We're not going to force anybody to get treated. As another House Bill 888 thinks we do. And I don't know that the governor will sign this one. He might just let it go. We did submit a veto request to the governor's office through statewide public health and Confluence, not individually. House Bill 888 it tries to say that public health forces, coerces, makes people get certain vaccinations or treatments. And we don't. That's against public health ethics. It's never anything that we did during COVID, even though they conflated it to say that. But any treatment that anybody took, any vaccine that anybody got, was because they had a conversation with their medical provider. They acted based on informed consent and free will, and none of us forced anybody to do anything. So this isn't about forcing treatment, forcing vaccination. It's about educating. It's about giving people the right information to make the decisions that they want to make to protect health, life, and safety of their families and themselves. So that's coming. I'm going to have the same conversation with our local governing elected leaders to let them know this is where we are. This is what's going to happen. And this is what we need to do to keep people safe. So that's the child care, the ARM 702 and 888.
I do want to point out, there's no room for John at the county jail, so.
So we will get pushback. We will educate the public and child care facilities and parents and others on why this is best practice in public health and why their kids don't want measles. And so we'll do everything we can to continue that messaging. There were a couple other different laws and regs. This did not pass, killed a bill that was going to allow cigar bars to open and allow indoor smoking. It's killing the Clean Indoor Air Act. We got rid of a bill that was going to shift tobacco funding from, tobacco settlement funding from focusing on tobacco use prevention to other things and essentially remove tobacco use prevention from happening in the state. There was a new bill passed that now states local air quality and state air quality regulations cannot be more stringent than federal law. So trying to align with the federal EPA and how they're rolling back some air quality protections. And then there was a new bill now that did make it through House Bill 807, prohibiting the use of vaccinations that are under a EUA or Emergency Use Authorization Authority. So the next pandemic, in order to help save lives and protect the public, whatever vaccine they develop for the next new bug will have to have full authorization and not be prohibited to be distributed in the state of Montana under emergency use authorization.
So that one passed.
That one did make it through.
How long was the COVID vaccine in that study?
Till last week.
Okay.
A long time. And then, Novavax just got approved. So it was a good session overall. The other conversations we had on policy were about our food inspection, restaurant inspection system. 98% of consumers surveyed said that kind of a scores on doors approach should be implemented. Owners and operators were a little less optimistic, but still gave a majority response, over 65%, 64% in support of this measure. And as we were giving this report in committee last week, Melissa and Clark were returning from the state Restaurant Association meeting and got some really great feedback, really good ideas on how to make this work and how to work with industry to make it work well.
The grading system.
Yes, that's the rating system. Other than that, it was a good meeting. Anything else?
Yeah, well, a couple things, a continuing thing that we're working with the city of Billings, perhaps to get a memorandum of understanding in which the city will be taking a board for enforcing health department regulations, working on possibly coming up with regulation, amending regulations on kiosk because of the recent concern we had, oversized kiosk brought up some issues. John talked about the rating system. There was a meeting, advisory meeting, May 13, sort of a first meeting on it, right, Eric?
For the gradings.
Yeah.
Yes,
Any results from that? Any good feedback, bad feedback?
it's very preliminary. Just what Melissa conveyed to me was just a lot of discussion. It's kind of a mixed group of consumers, business owners, and other stakeholders. And so there was just a lot of talk about, you know, the interests of consumers, the interests of business owners. So yeah, that was really just the forming meeting. So not a lot of, movement on content just yet, but.
Okay. And then we said with the lack of action by the legislature that we would look at possibly formulating some sort of regulation regarding Creighton, see if that's possible. But that's also continuing. And then we received a report on the occurrence of foodborne illness risk factors, which is a survey done every about 5 years, been done for about 12 years, and no significant risk factors, but it was pointed out that a big issue is whether or not there's presence of a certified food protection manager in these places, and that's something we're going to encourage, because that just seemed to make a difference if you have a trained person available. That was it. We're going to meet in June, but then we'll decide then whether or not we can go to every other month with the legislature being on the country.
Yes. Any other comments or questions for the policy committee? Hearing none?
Do we need to approve the minutes?
No, we do need to accept the report. Can I get a motion to accept? Yes. All in favor? Opposed, same sign. Spencer, what happened in the land of the bean counts?
With that introduction, first of all, I want to acknowledge that I think we have over 20 pages of financial reports in our report today.
Yes.
So just much appreciation to Shanna and Tyler who prepare that information. It's a lot. Let me I'll give you just a brief outline about what's presented in the package, and then I think we'll stick with just the RiverStone financials. I think that's what you're familiar with. I think in the words of our former finance committee chair, the Jim and Darlene analogy, here we're going to focus on the gym in this scenario, which is the road we've gone. But
You always spent most of the money, so.
that's right. But what we have included are RiverStone, March 2025 RiverStone financials, March 2025 YHP financials, and then the combined financials, which at the end of my presentation, we will recommend acceptance of those financials. And then in addition to that, we've got the preliminary budget along with the preliminary capital budget. And then the preliminary public health mill levy allocation, which we will also ask for your acceptance at the end. So that constitutes the package today. But if we start with the RiverStone financials, which if you're on your computers, that's page 24. Cash totaled 12.6 million, which is an increase of about 4.6 million over fiscal year and over the course of fiscal year 2025, which at this point, for these reports, this is 9 of the 12 months. So our fiscal year will end at the end of June. So of that cash, 9.2 million is unrestricted, which gives us a total, the metric that we've been following more or closely lately is the days cash on hand. That puts us at 58 days cash on hand, which is an increase of 33 days over year end in 24. So I think a remarkable progression. You'll see that towards the end of the financial package, some graphs that illustrate that, but certainly a remarkable measure, a remarkable achievement. So at the end of March, we had deferred revenue of 3.1 million. That's consisted largely of funds restricted COVID, which is 1.5 million. And then but otherwise our financials are consistent with our previous month's financial. I mean, I should say our balance sheet is consistent with our previous month's balance sheet. So, any questions on the balance sheet before I move on to the statement of revenue? Statement of revenue here. So at the end of March, we had operating revenues totaling $5.4 million, with expenditures of $4.8 million, resulting in a net operating income of $630,000. That is a positive variance over our budget by $654,000 still. So another good month for the organization. Overall, the net revenue for the month was $671,629. If we look at that at a year-to-date basis, operating revenue was $47 million, with expenditures of close to $44 million for an overall net operating income of $3.3 million. That is also a positive variance, but of $3.8 million over budget. So compared to budget, we're performing quite well. And that is what's propelled our ability to preserve cash, meet that some of the bond covenant expectations and whatnot. So if you look at that, I did pull the financial statement from last year just to kind of as an eyeball test, and in nearly every case we're performing from a revenue standpoint either on par or in excess of where we were last year. And then I thought this was significant that if you look at our overall expenditures, the organization as a whole has decreased expenditures by a significant amount, over $4 million from previous years. So I think that just is a testament to the number of cuts that we made last year, as well as the organization's effectiveness in implementing that strategy. So overall, a good month, and from a cash position, we feel much better about where we are than we did about a year ago this time. So I think overall, it's the organization from a financial perspective is doing quite well. Everything's moving along quite well. Any questions on the statement of revenue or expenditure? Okay. So there's other financial reports included in the package, or feel free to look those over. Like I mentioned, we have the 2025 financial reports for YHP, as well as the combined financial reports for YHP and RiverStone. So, but the next thing I'll touch on is the preliminary budget, which begins on page 36 of your package. If you're looking at it electronically, there's a considerable amount of time and energy that goes into the preparation of the budget. So appreciate once again Tyler and Anna putting this together. This is of course preliminary. So, but just some of the things that, you know, we've had an outstanding year this year financially. There's no way that we're not going to see the same level of performance from next year based on a couple of factors, which Shannon has outlined in her report, and I'll highlight now. But you know, I think we still expect to have a real positive year next year, but you know, but there's just a few things in here that need to be put in that are going to kind of reduce the amount of revenue that or net revenue, I should say, that we've been able to generate over the course of this fiscal year. So first is to make sure that our staff, that we're meeting our obligations to our staff. So there's it's in the budget, $968,000 increase in salary expense, as well as a $763,000 salary increase for new and additional staff positions. So again, I think the staff can probably attest to this. In some areas, we're running a little lean, and then we, as you recall, last year we didn't have any significant staff increases that for our staff salary adjustments needed there. There's also some additional costs. There's going to be some additional costs related to some legislative changes with 340B, as well as we'll see we're about $1 million lock in COVID funding. So with all that being said, we're still well positioned financially. We're still going to be able to meet I think we'll be able to meet the challenge the board approved a few months ago to preserve or to add 20 additional days in cash over the next 2 fiscal years. And that seems very achievable, even as we adjust some of the expense measures. So overall, the fiscal year 2026 budget calls for a net loss of $132,000, but it feels like a very good, solid budget. A lot of collaboration has gone into play to create this budget. So it's just the bean counters in the back room making up numbers. There's a real concerted effort to get everybody involved. So I think I really appreciate that approach. I don't know if Jim or Carol, if any of you have anything to add on top of that. Jana, anything you'd like to add?
I'll just add that the plan is to come back with a final budget, obviously, in June. We're still working through things. So my hope is that it's closer to break even, if not just a little bit positive bottom line organizationally, to bring back that final draft for review and approval. And I will say, just based on this draft budget, as we look at adding days cash on hand, this draft adds 5.88 days cash on hand for the next fiscal year. So even while it's a little bit negative, there's some non-cash expenses in there, such as depreciation. And so we actually will add cash based on this draft budget.
And I think, to Shannon credit, I think we're taking a conservative approach that's been with the budget that we did last year in hopes that we can over-deliver on some of those measures. But I think a job well done. And they've assured us that there's definitely still space in this new budget for innovation and positive projects. Last year there's so much emphasis on cut. Obviously, we're still operating efficiently as we can, but there is space in there for some innovation and some development. So I appreciate everybody's help on that. So the last page, this is beginning on page 40 for those of you that are working out with like I am. It's the mill levy allocation graph. You'll find that it's the page with the pie chart at the very top. So I'll let Shanna speak to our mill levy, but I don't screw it up.
Yeah. And so we just have this approved at this meeting because we will present to the commissioners prior to the next board meeting for our allocation of mill levy for this coming fiscal year. And so in the board packet on page 40, it outlines the difference between our fiscal year 25 final budget amount and what we've drafted for fiscal year 26 as it relates to the different areas within the organization, how that's being allocated. A couple of significant changes this fiscal year is we've now worked to get that mill levy back all allocated into the public health programs. Previous to the last couple of fiscal years, we had some going to hospice house, we've had some going to dental past. In this last fiscal year 25, we had a chunk going to home health. And so we've worked to allocate that and align it better with the public health program. We are seeing an increase, a preliminary increase in our public health allocation, reaching out to the county for those initial numbers. And so we have about almost $3.5 million right now allocated. So that's about a $269,000 increase from last fiscal year. We continue to reserve for a chunk of protested property taxes. We always have done that historically, just in case we encounter that. And so we actually, our actual mill levy allocation is expected to be about 3.5% higher than that about 5 million. We allocate that just in case we do encounter any protested property taxes, which has happened in the past. And so just looking at the fiscal year 25 to the fiscal year 26 changes, you'll see if you're following along that decrease in the home health amount. We also have a decrease in our PHSI, Public Health Systems Integration draft budget. And then we also have, probably most importantly to point out, an increase in our disease control allocation up about 261,000. And that's really due to the loss of COVID funding. So just allocating more of our mill levy into that program to account for the decrease in that funding.
Any questions on the mill levy allocation? So then this goes to the commissioners and they have to either approve it.
Yep.
And if they don't, what happens then?
We'll be back to the drawing board.
Never happened, but never done.
Yeah.
June 23rd, we'll go to the budget hearing, right before our June board meeting.
So comment your questions of Spencer or Shannon? Hearing none, can I get acceptance motions for the May financials? March acceptance March. And the May committee notes. A second. All in favor?
Aye.
And a motion to approve the preliminary mill levy allocation.
I'll make the motion. Second.
All in favor?
Aye.
Opposed, same sign. They are passed. Safety and quality.
Steve, is your hand still up for a reason?
Well, yeah, there were a couple of comments I was going to make, so I didn't want to butt in like I typically do. So I tried this way. First of all,
How'd that work for you, Steve?
yeah, it's painful. I will tell you, it is painful. So leave it to Warlick to do something. Hey, first of all, I think for the entire organization, John, your senior leadership team, I think the financial of where we were a year ago to where we are today, what a turnaround. I mean, a huge turnaround. And then, I hope everybody appreciates the fact and the sacrifices that people have made for the organization. It's substantial from that standpoint. And Spencer alluded to it, but I just wanted to let you know from a business person, I look at it and it's like, wow, job very well done. It was interesting to see that you were able, and I know labor is a tough one in my business and even in the Best Western here. It's difficult to control the labor, but the fact that you did this past year, I think it speaks volumes to the organization. So, Spencer, it was interesting. I was running numbers. It'll be interesting to go back and look at the percentage of labor and wages and overhead as a percentage of goal, because it's how we measure it as well. So that, and that's dropped. So that's good. And you show it going up in the budget for 26. So that'll be interesting. But I just wanted to say I think it was a job very well done. So I can lower my hand now. Or I guess it is already lowered.
I've lowered it for you, Steve.
Thank you.
Yeah, don't take that power lightly. No, thank you. Appreciate the comments and just, kudos to the entire team and leadership across the organization. I've always been a turnaround guy. And 3 years ago when I came here, I said, hey, good, I don't have to turn anything around. Well, I should have kept my mouth shut. But thank you. Appreciate you guys.
All right. Thank you.
Thanks, Steve and Lionel. Now,
Okay, so this was the Safety Quality Committee, where we came to learn that we get about nearly 15,000 emails every 24 hours, which poses a problem because that's nearly 15,000 opportunities to have our system breached by bad actors. So we spent the time talking about cybersecurity. And whenever you talk about cybersecurity, it's always a sobering discussion, and that meeting was no different. But we did learn about what measures are being taken by our staff here to keep us safe. About 10% of our budget is spent on cybersecurity related issues. We did come to learn that even our CEO had recently identified I guess it was a phishing attempt, and that one was taken care of appropriately. So you're serving as a good role model. This is an issue that is not going to go away. We're going to have to spend more time and resources, which means money, on keeping us safe. We learned also that we have a number of systems that are considered relatively high risk. Our dental DEXIS system, whatever DEXIS system is at some risk. Our home health and hospice matrix care system is also one that's at risk. Apparently, these are two systems.
They are both our health records for dental and home care.
Okay, and so they probably need something to make them safer for the organization. So that's pretty much what we spent our time on. Those of you who were there with me, anything else?
No, you got it.
It says the healthcare is the biggest target.
Yes.
What about the incentive? I mean, it always seems to me I'd be looking at the banks or.
Well, what happens is they get access to the patient information, then they can submit fraudulent claims to the payers. So it just, I think that's the main.
You get access to that. You can get access to your personal, patient personal information, social security numbers, information like that. The claims hacking is one of the most profitable arms for them. But then in larger situations, they're trying to gain access to hospital systems across the country. And then you think about all of the web connected hospital systems and critical infrastructure that is now on the Internet of Things. So IV pumps or pacemakers or other surgical implants. And you get attached and control those things. You can kill people. You can do a lot of havoc. And then, that is what they're after, is what are the things that we can hack and do the most damage.
And another avenue of risk is, another area of risk is the relationships that we have with our other people who interact with this organization. So say somebody, one of our subcontractors or some people, they get hacked, and then it's through them that they get it to us. So
yeah, that's one of our biggest threats, and that's where most of the spam, the phishing attempts come from, are community partners. And the community partners are sending, typically I got an email, and I said, oh yeah, I usually get an email from this person, must be safe. But when you look at it, it's very much not. And I even emailed the person back immediately and said, hey, did you send me a note? And the email I got back was from them, from their email account, that said, oh, absolutely, yeah, I was just sending that for your review. And I said, nope, that individual would, one, never talk to me like that, and two, they usually have an email signature that identifies what organization they're with, and that email did not have that. So I've been trained in this for many, many years, but some folks aren't, and would have said, oh, okay, great, I'm going to click on that and open it. And that's where the biggest risk is.
I just a quick story. I got a letter yesterday saying, gee, there's some unclaimed property. There's some money that you're owed from this organization that I do some work with. And so I thought, and the logo on the bill, on the letterhead, seemed a little bit different. So I had to not use the telephone number that was in the letter, but own way to get in and find out that, yes, they owe me money, so. Yeah.
Yeah, no, they're getting more sophisticated than you just have this long lost uncle who used to be a Nigerian prince.
Anyway, that's.
Great, thank you. Any comments or questions for the committee? Hearing none, a motion to accept the report. So,
Second.
all in favor?
Aye.
Opposed, same sign. Executive committee is trying to prepare an annual review for John. When we have one drafted, we'll bring it back to the board with your input. We've met twice. The notes, I apologize, are late. I'm learning to ride the bike and board chair here. And we are preparing, a review, what went well, what may not have gone well this past year, and what would we like to see happen in the next year.
And if anyone has any comments or questions, please let one of us know.
Send your suggestions to us. We have brought in new vernacular called KPI, Key Performance Indicator. A technique vernacular Steve brought to us, a technique that I certainly used in hospitals. I'm sure Carol has seen them in hospitals. Spencer, I'm sure, has something like it in banks. And you try to set benchmarks. Think of the conversations we've had for 3 or 4 years around cash. When we came out of the pandemic, cash was very low. And so we started focusing on how much cash is in the bank. And I directed my reports, finance committee reports, to how much cash there was. We refined that to where we started focusing on unrestricted cash, because was always having to give you mental calculations at the board meeting to subtract the cash, committed cash, the restricted cash from the unrestricted. And we have now made another change to days cash on hand. There's a chart in your package from finance of the days cash on hand, and that is essentially KPI. We brought that back to the board 2 months ago, a month ago, or finance committee did, to get your endorsement of setting a target to add another 20 days of cash over the next 2 years to improve liquidity, because it is not anywhere close to where it was pre-pandemic. And that's how you use these kinds of things. So executive committee is engaged in that conversation. How do we create KPIs for RiverStone covering all facets of the organization? And staff is engaged in working on these. So if you have thoughts, share them with the committee. We don't have it done. It's going to get transferred to governance this morning after this meeting, the responsibility, because implementing them and having them concrete as soon as you flip the light switch is very difficult, as evidenced just by what we did with cash. I've changed that multiple times over the last 3 or 4 years. How we monitor, again, from cash balance, to unrestricted cash balance, to days cash on hand, unrestricted days cash on hand. And we will refine whatever we can put in place for the rest of the organization. Our second meeting was focused largely on the KPIs. And one of our discussion points was they're not going to be like a light switch when you turn them on, which is what we experienced, which is why I'm going to take this to governance so they can work on it over the ensuing months. And we can move on with John's evaluation and work with him on goal setting for the coming year. Comments or questions about the executive committee notes in front of you?
Hey,
Hearing
Jim,
none. Yeah.
Hey, Jim, just one other comment for the board. One of the advantages of doing this and getting it to one is that as a board member, it's much easier to understand where the organization really sits and how it's progressing. And these KPIs don't, they're not many of them. There are probably 5 at maybe max. And they're really done to give you a pulse of where the organization is, what's happening. It also allows the organization then to look at their strategies down through the ranks to understand what they're doing, how does that impacting the overall KPIs or overall health of the organization. And it's a little bit different in vernacular. I think that we've probably been doing this, but from a board's perspective, it's difficult when you just look at the reports and you say, oh, this is where we are. Financial's easy because we can say, hey, we got money or we don't have money. So I think we're hoping that it will be helpful for the board to have a much more involvement as it relates to the overall organization.
We're trying to pick
I think it's a great idea. Yeah, I've worked under KPIs forever. Yeah. I'm a big fan.
we're trying to pick things that you bring days cash on hand to the board. And if you see a change in that number, people like Shanna and Spencer and Carol and I can all relate that change in cash to anything else that happens in the organization. We can trace it back to the other interruptions, whether staffing, patient volume, payer mix change, cost of pharmaceuticals and acuity change in the services we're providing, all kinds of things. We can trace that back to any other variance anywhere in the financials. Okay. Motion to accept to close the meeting. Minutes. All in favor?
Aye.
Okay, with apologies, Kelly. Good. 17 minutes.
Can you breathe?
Good. We can be attentive.
Stay back here, or do I
You can
go up there? Okay.
feel free. It's next to Carol.
Oh, okay, or I can stand too, like either way. Hi, everybody. My name is Kelly Amade. I am the Director of Organizational Innovation, which is our projects here at RiverStone. And thank you so much for letting me come and talk to you about our current projects that we're working on. So in the packet that you're all received, this first slide is a great summary of all of the projects that are currently in flight right now at RiverStone Health. This dashboard, if you will, is something that I share with senior leadership every 2 weeks. And it uses, as you can see, everyone's green now, so you can actually see that it is a stoplight system there. So if there's any projects that are in, excuse me, I can't think of the word. It just flew out of my head. If they're at risk, geez, that's an easy word. If they're at risk, I bring it to senior leaders and we talk through if there's anything that they can go make changes. So I'm actually going to move forward to the next slides because just to review what the projects are themselves. Our first one here is ECW development. It is optimizing our electronic medical records, so where our clinicians are documenting their patient encounters. This project is actually quite a long-term project with lots of almost little phases within. So there are small scopes that we're focusing on as time goes on. Right now, our focus is on 4 actual things here, which is it's quite a big scope. Having our televisits, so telehealth upgrades from Zoom to a new platform, updating the actual software itself, making sure that we've got the newest security updates, that kind of thing, the newest features. Moving to the cloud is a big one. So right now, our electronic medical record is all housed on the 3rd floor of this building, which is good for some things, but is a lot of risk for others. Power outages, safety, as you were all talking earlier about cybersecurity.
making sure that we don't quite have that infrastructure, as it is very expensive as time goes on and technology gets more advanced. So moving our system to a cloud system, which is, I always like to say a cloud is just someone else's computer, but that other computer is very sophisticated, protected, and fast, also efficient. And then finally, the other focus for ECW optimization is the ease of signing in. So at this point, we're trying to do what's called a single sign-on, which means that staff can just click a button and they will be logged in. They have to sign into their computers, of course, so that there is safety there. But by pushing this button, they can just get right into our EMR. This project is actually, well, we have a very big weekend this weekend with a very big day on Tuesday. So I'm not sure if you guys heard about this, but we will have ECW will actually be down. We will have a downtime. We'll be using paper for our Tuesday following Memorial Day to make sure that people get all these upgrades up the building. The scope of that will be done by July, and then we move on to the next ECW optimization. The next project is our Child Advocacy Center. This project was to integrate forensic medical exams to our Child Advocacy Center. As you know, that what we've been doing for years now is the forensics interviews, where we had a partner with Billings Clinic doing the medical visits. That partner has retired, and so the community did not have anyone that could do forensic medical visits. And so that is what this project is for. We have actually got that up and going with Dr. Littlefield spearheading and being the single provider right now that is doing these visits. We are developing to more providers to help her out as well. But as far as the project goes, it is nearing completion as we're just making sure that it's operationalized. The next step is, however, probably another project that has to do with developing a center of excellence for our Child Advocacy Center. The next mobile unit. So I think everyone got a tour this morning of our mobile unit. This is a very fun project. This one has a very, it's a small team, but a great multidisciplinary team that has been working on this project to get our services out to the community. So as you know, we have our the mobile unit has been delivered. We have it actually operationalized. Today will be the 4th outing for the mobile unit to see patients. The next steps for the mobile unit is to develop the dental and behavioral health services on the unit. Right now, we held to do just medical due to staffing issues, but now we're at a place where we can possibly get some more staff to be able to offer the dental and behavioral health services as well. The secondary, but still a very separate project, is the mobile unit garage. So as you may know, if you have RVs or driven buses before, there's of course a lot of upkeep with it, and we want to make sure that it stays nice and protected. So we are adding on to our current garage, expansion, words are, an expansion to our current garage, which will have all the necessities for us to be able to fill up, dump our black water. It will have electric so that we can make sure that our fridges and freezers stay on overnight. So medications and such can stay on the bus. And also be a great place to keep it protected. So we are partnered with Sukansi Construction, and they are off and going right now. If on your way out, you can probably see all the construction that's happening around there. They just recently poured some concrete, so that's an exciting development there.
So it's not a typical garage because 600,000 for a garage seems like a lot.
It's a really good point. Well, our car is 40 foot long and 13 feet tall, so that's our garage has to be.
It also has electrical hookups so that we can keep the refrigerators and stuff
Right,
running
right.
when it's parked in there because they'll have vaccines and stuff in them. It's got a sewer dump.
Right, I mean,
Yeah.
it's not
No.
a simple garage.
It's heated.
Yeah, a couple other things. It's actually 2 bays, not just one, because we anticipate that we might want to expand and to make it easy for our staff. It's a drive-in, drive-out because 40 feet of vehicle, we all know what could happen with 40 feet of vehicle. So the idea is it's easy to open a door, drive through, come back around. So yeah, some enhancements to it, Dr. Tappy, just to make it a little more user-friendly for our staff. John will tell you, we are 1 pound short of requiring a CDL for our drive.
Yes.
Backing that up is difficult.
Yeah.
It's,
But Dr. Littlefield did it with ease.
well,
So you,
Yeah.
you're not gonna ask me to draw. I'm not gonna be first on the list to maneuver that thing, but I can do it. I can do it. I was approved.
I did back it out of our parking lot last night, so you did,
Yeah.
where it was yesterday, so.
Be surprised how expensive those big bay doors are.
Yeah.
yeah. Okay, my comment was just gonna be, so you're saying the garage has a lot of wow factor?
Yeah.
I tried to get them to have the man cave and have the golf simulator, but it's not that kind of garage.
Yeah. We haven't had quite the support for that.
Yeah.
So do the drivers have to have periodic refreshment?
Refreshments?
So non-alcoholic.
Refreshment, yeah. Refreshers.
Refreshments.
And we did, we partnered with Met and went over to Mass Transit for the morning. We did a half day. We're gonna do another half day with them, but Mike, right? Mike Pope. Mike Pope, Sherry Pope is in our family health services service, and not family health services, but one of the staff here, and she preventive health. And her son works at Met, and we were able to work out a deal with them. We paid Met a little bit of money and got a driver training course, and we took the CDL quick course, the CDL test actually, to drive the vehicle, stop it, back it up, turn, do all the things. So it was a good opportunity to train, and they're going to continually work with us and train us and point out things on the manual and walk us through the vehicle.
They were really great. He actually went through our manual to give us pointers for everything on the bus. So it was really great. And they're really trying to develop that arm of Met Transit as the training portion. And so they're very excited to work with us. And we're excited to do some winter driving training with them as well. Let's get through summer, but then when the snow comes again, we'll do that. Okay, real quickly, I'll go through these last ones. Data classification is another kind of a doozy of a project, more long-term. It is interesting in that it is a quite technical and somewhat complicated concepts that we're trying to make sure that everyone in the organization knows so that they can properly store their data and that we can get ease of access to that data. So this is a big project that will take until, till the end of this year, but with some extension into our deadline is October of 2026 as some of our data housing is is sunsetting. And so we need to make sure that we move our data before that happens. MFMR and the CHC scheduling software. This is also an exciting one. Currently, our scheduling team does everything very manually. And so this software will help enhance a lot of efficiencies, features, a real efficiency, but then also staff satisfier for this one. This one will actually not start until August of this year due to the NFMR residency schedule. So this one is just in the beginning stages of the project. And finally, the newest project that will be, we actually haven't even had a kickoff yet, but it's something that I wanted to share with you guys because it's kind of hot off the presses, is our HS GovTech software. This is for our environmental health department to upgrade and modernize their current system. We are partnering with the state of Montana for this one, and they are paying for a lot of it. We do have some extra modules for which we require for our work that will cost us a little bit more money, but as far as the majority of the cost is being shared with the state of Montana. And then finally, the last thing, the projects on deck, just very quickly, online scheduling is another ECW optimization feature. That is something coming right after the July 25 or the July end date of what we're currently doing. For Cura is a software for our home health and hospice teams. It is to hopefully expand our referrals to our teams. Dexis, we talked about this a little earlier. Dexis is actually the X-ray software that our dental team uses. So updating that, it's I believe a year past its time where it needs to be updated. Automation Droidal, that's an interesting one. That is where we can utilize a computer to do not menial work, but repeatable work that can be done digitally. That is something that Droidal can do for us. Career Center. This one is kind of an expansion of the mobile clinic, but also our school-based health centers, is to get into the Career Center for behavioral health and medical exams within Career Center. And then finally, the big one, exciting, is our Enterprise Resource Planning, or an ERP. That is a large software that will actually bring together our purchasing, our fiscal projects as well. It's I'm going to talk too much about it over time as well, but if you have any questions about it, please reach out to me. I'm 1 minute over, but is there any questions for me about it?
I have a general question. Yes, what's the definition of a project that makes its way to you?
That's a great question.
I thought it was too.
Yeah. So we're in the middle of defining. So I came in from Judy Stewart, and where we were doing process improvement, and so now we're really trying to focus on project management as well. So it's a little bit different, and as we're learning, projects actually at this point, they come up through me, and then I take them to senior leadership, and so then we talk it out in senior leadership to see if this is a priority for the organization. As organizational innovation is only me, there is no one else, so we do have to be pretty strategic about what projects that we do.
So every project yours comes through you?
Yes, correct. And I do not make any choices on any. I am a conduit for which they go through, and we talk it through.
Carol, a few things. We're working on automating intake, so the business units can put forth a project for assessment. And as you might expect, projects that require other departmental resources is a big indicator that Kelly's team needs to be involved. And then dollar threshold, right? Okay. Because as you might imagine, she would get inundated with every single project. Now, what we want is visibility to every project, because even if I'm working in my own department and somebody needs some help, I'm still not available to help with that project. So it really is on a path from a fledgling process to maturity. And so we are continuing to refine some of this to better align it so that, again, we're delivering capabilities to the business in a timely manner, while at the same time, we're keeping costs down and being cognizant that our resources only have so much availability.
Thank you.
So I got a question for you. When you're looking at these projects, do you look at them as they currently are, or as you look at them as they could be potentially reimagined? And I hate the word AI because it's sort of this big dark gray hole that nobody really understands, but it does seem to work. And so, we look at projects and we look at where we are and where we want to be and how we can redo or revitalize processes that could be incorporated via AI. Is that part of when you're looking at these things, is saying, okay, we're doing it this way, but down the line with AI, I have the capability of doing it a totally different way, and let's work towards that versus the project at hand. Where's that fall in?
That's a great question too. Everyone's got great questions. So actually, when it comes to AI at this current time, it's per project and per the software that is being included. So for example, when it comes to the ECW optimization, there is AI that is built, some features of AI in which we want to incorporate into our workflows. So we don't necessarily have something greater for all of project management that we can add AI to, but absolutely is a conversation that we have, is how can we make things more automated. That is in fact one of the other kind of project that I rushed through at the end there is the Droidal software. That is the one that it's not exactly AI. It doesn't think for itself, but it is a way to automate processes to remove not in a good way, remove the human from the process, because these are menial tasks and there's value added elsewhere that they can do. So that is always a question that we evaluate for each project.
So Steve, a couple of things. Firstly, your question is why we aligned project management with OI, because organizational innovation is key to how do we do things better, faster, right? And so that was part of that alignment. And secondly, we don't ever talk about what we need to do for the today. Historically, we did a lot of that. We put out fires every day. Now we're talking about what does the future look like? How are we positioning capabilities that we are putting in place today that are going to meet future needs? And how does that line up into the strategy that you all have put us on course with? So we are absolutely always thinking about what can the technology do. And Shanna is a great litmus test, because as we talk about things, we're always talking about technology and innovation against FTE counts. And how do we balance that out? And in some cases, we find that technology is the better solution. It's less expensive. It never goes on vacation, right? Droidal is there 24/7, 365. It has no idea that there's a holiday. It just does what it does against, again, FTEs, where sometimes we need an FTE because the work is such that someone has to have eyes on it. But we are looking at all of that on a continual basis.
Okay.
There have been those conversations already with certain staff who have seen that light pop off and said, hey, wait, that's my job, or that's what I do. And we've said, yes, absolutely. This is what you are doing and spending a lot of your time on. Let us help you implement a tool that can do that thing so that you can do this more important task that is much more meaningful and more productive for our patients and our clients and the organization. So it's already being seen as, well, not a potential threat, but not a threat, more a force multiplier.
Okay, thank you.
Other comments or questions for Kelly? Hearing none, Kelly, thank you very much. No time for feedback today, unless Michael, you have a final comment? Okay. We are adjourned. Governance will meet eminently.